1996, Manitoba has officially had a diabetes epidemic. I tabled today a graph from this government's own data showing the number of Manitobans with diabetes steadily escalating upwards from just over 50,000 when this government came to power to just about 100,000 today. This is the equivalent of a city of Brandon full of people developing diabetes while this government has been in power. The straight line shows that there has been no impact by any of the NDP government's list of programs on the diabetes epidemic. I asked the Premier, why is it that his government has been so unsuccessful in addressing the diabetes epidemic in our province?
First of all, I thank the member for their question. It is a very important issue, diabetes, not only in Manitoba, across the developed world. This is a scourge that is hurting many, many communities, many individuals, and many families, which is why we increased the physical activity requirements in our public schools. There has been an increase of over 10%, which is exactly why we've gone from a handful of community gardens in northern Manitoba to over 900 now, which is why we implemented the prenatal benefit to ensure young expectant mothers get off to a good start with good nutrition. It is an important issue. We will have to keep working on it. Physical activity, access to good nutrition, proper health care from the earliest days of starting a family, and continuing support at the community level to help people be mobilized physically and to work in groups and to do things together. We see this actually quite a bit in Manitoba now, Mr. Speaker. You can go to just about any mall in the wintertime in Winnipeg and see seniors out there walking and doing things together. An active living program is one of the keys to fighting diabetes.
Mr. Speaker, I now table a second graph that shows what should be expected if effective measures had been put in place when this government came to power in 1999. In this model, measures to reduce diabetes gradually improve so that the number of people with diabetes starts to plateau and then decline. We are not seeing this type of graph in reality today because the Minister of Health has not done her job to prevent diabetes in our province. I ask the Premier, when is he going to shuffle his cabinet and have a more effective Minister of Health?
Again, Mr. Speaker, diabetes is best dealt with through prevention so that people don't get it. Type 2 diabetes can be eradicated through lifestyle choices, and we have to support people to have a healthy lifestyle. We're doing that with changes in the curriculum in our public schools. We're doing that with active promotions of seniors' activities. We're doing that with workplace health and safety programs. All of these measures are intended to reduce the amount of type 2 diabetes in the province of Manitoba. We want to keep people moving. We're investing very significantly in our park system to allow people outdoor opportunities, recreation opportunities. Again, all of these measures that we've put in place have been voted against. People have wanted to cut these measures on the other side of the House, including the member from River Heights.
Mr. Speaker, I table a third graph from this model with the number of people in whom diabetes could have been prevented if effective measures has been taken when this government initially came to power. It shows slow initial progress in the number of cases prevented, but then gains momentum so that after 14 years, today, about 30,000 people are prevented from developing diabetes. That's huge. Think of it, Mr. Speaker. 30,000 people in Manitoba who might be healthy today without diabetes. When will the Premier admit his government has failed not only these 30,000 Manitobans, but all Manitobans? And when will he find a new Minister of Health who can properly prioritize and address the diabetes epidemic?
Again, Mr. Speaker, the member opposite was a member of the federal cabinet that cut health transfers by 39%. Wow. And those cuts in transfers and the freezing of support, to First Nations communities around Manitoba left a lot of communities very much at high risk. We're working with all these communities. First and foremost, we're promoting healthy living activities at the schools level before children develop lifestyles which lead to type 2 diabetes. Secondly, we're promoting recreation programs. We're particularly focusing on the activities of young people between 3:30 and 8 o'clock at night after school so that they're doing active living activities. They're learning, they're involved in things that will allow them to be successful in school, and that includes physical activity as well. We sponsor many summer activity programs, and we have actually invested very heavily in recreation facilities community clubs, playing fields, activity centers all across this province of Manitoba. And every single member on the other side of the House has said that those investments are not worth the money. They have said cancel.
Order, please. The Honourable First Minister's time has expired.